Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking with Steve Buckley, a PT/OT supervisor, talking about school-based occupational therapy programs. Steve, welcome. Thank you for joining us.
Thanks, Dr. Brookmeyer. It's a pleasure.
Yeah, so can you tell us a little bit about occupational therapy?
Sure. Occupational therapy definition is one that looks on participation and engagement in meaningful activities to promote health and well-being. That's a very broad definition. How it relates to occupational therapists in the school-based setting is that OTs have a unique expertise in fine motor skills, or the ability to manipulate the writing tool, also visual motor skills, which is eye-hand coordination, which supports the complex task of handwriting. Occupational therapists also have a unique expertise in the area of sensory processing, which is basically a child's ability to take in sensory stimulation, process that information, and have an appropriate response.
Okay, I think I have some questions, but let me start first though with, can you tell us a little bit about the school-based occupational therapy services in Frederick County?
Sure. All of our occupational therapists in Frederick County are hired through Frederick County government. They're housed at Frederick County Developmental Center, which is in the health department. All of our therapists go out to every 65 Frederick County public school. They work with children aged 3 to 21 who have been found eligible for special education services.
So then, what is the role of the occupational therapist in the public school system?
Well, occupational therapy in the public school system is a related service provision, which falls under the Individuals with Disabilities Education Act. An occupational therapist's role is to support children and help them benefit their special education program.
So how do students, I guess, access those services?
Well, first, students have to been found to be eligible to receive special education services. Once that happens, there's an IEP team, which is made up of members of the school team and also a parent and the occupational therapist. They review assessment information, look at students' weaknesses and strengths in their educational setting. They draft goals and objectives, and once those goals and objectives have been approved, then the team discusses services. What happens is the occupational therapist looks at whether their unique expertise is needed to help that student achieve their goals and objectives, and that's determined based on their service needs.
So do students ever graduate or find that they no longer need OT services?
Yes, we can work directly with students one-on-one in a pull-out fashion or in a group setting. We can also work with students on behalf of them, or working on a consultative model where we work with their assistants, their special ed teacher, or their general ed teacher. But when we're looking at whether we want to discontinue services or not, basically we hold an annual IEP meeting, we review their goals and objectives, and if they've met their goals and objectives, we may discontinue them from services. Or if their participation in their educational setting is appropriate, we may not need OT services, or even if their accommodations and modifications no longer need the unique expertise of the occupational therapist.
So can you talk a little bit about what I imagine there's a difference between the school-based occupational therapy focus and maybe occupational therapists who work out in the general community?
Yeah, there's a big difference between therapists working in an outside community environment. They follow a medical model compared to our therapists that work in an educational model that follow the IDA, or Individuals with Disabilities Education Act. And I think parents get frustrated a lot of times when they have an outside assessment completed and they bring that to an IEP team meeting, and we can take that information into consideration, but oftentimes we need to do our own assessment, again, because we're looking at participation in the child's educational environment, which is something that an outside provider doesn't have access to.
And then so I imagine you also have a different focus then and the focus is what the students need to succeed in the school setting, which is different from all the other activities that they may do outside of school.
Exactly.
Very good. Well, if parents would like more information, where can they go?
Well, we have some additional information up on the screen. First, federally, they can take a look at the website that has more information on the Individuals with Disability Education Act. We also have some state-level websites that they can go to. One is COMAR regulations, and the other one is the Maryland State Department of Education's website. We also have a website up there that is a guide to practice. That guide was developed with local and state program heads, along with MSDE, to give local therapists and parents information on OTs working in an educational setting. I'd also let parents know that they can also contact their teacher and even their school principal for additional information, or they can contact myself, Steve Buckley, at 301-600-3233.
Well, Steve, that's great. You provided us some really good information and probably answered some questions that parents have had about, well, the private provider out there and the community occupational therapist said that their child might need some array of services, and then the IEP team focused just on the educational portion of the day. So I think you helped to explain why there might be those differences. And also encouraging parents to talk with their teachers or school administrators if they have questions about their child's ability to access what's available in school.
Great. It was a pleasure to be here and meet with you.
Thank you. Thank you, Steve. And now please stay tuned for this month's Medical Myths.
Soccer is fun to play, a great sport to learn teamwork, and can also help keep players physically fit.
There are many benefits to this team game, and Parks and Rec has opportunities for up-and-coming players of all abilities.
We offer clinics, camps, and leagues for novice to intermediate players.
We've also teamed up with Challenger British Soccer and UK Elite British coaching staff to offer clinics at multiple parks throughout Frederick County this summer.
Are you looking for that perfect spot for your child's next birthday party? Look no farther. Frederick County Parks and Recreation can fulfill all your birthday party needs. Choose from any of our rec center locations. Your party rental includes tables, chairs, paper products, on-site facility supervisor, and much more. Pricing for our parties is $120 for 2 hours in our rec room, or $170 for 2 hours in our rec room and gymnasium. For more information and availability, call 301-600-2936 or visit us on the web at www.recreator.com.
Hello, my name is Doug Orner, and I serve as Director of Volunteer Fire and Rescue Service for Frederick County. I've been a volunteer with the Vigilant Hose Company in Emmitsburg, Maryland since 1972. Why do I think it would be a good opportunity for you to become a volunteer? It's a great way to meet new people, learn new skills, and also you can receive college credits for some of the training that you receive. And there's always that reward of hearing a special thank you or a smile on somebody's face whenever you've saved a life or helped them in some way, shape, or form. For more information on becoming a volunteer, visit our website, stop by one of our 26 stations throughout Frederick County, or give me a call at the office. I'll be glad to assist you in becoming a volunteer. Look forward to seeing you at one of the stations in the near future.
And now here's this month's Medical Myths. This month's medical myths are about anger. The first myth from a SAMHSA publication is that anger is inherited. One misconception or myth about anger is that the way people express anger is inherited and cannot be changed. Evidence from research studies, however, indicate that people are not born with set and specific ways of expressing anger. Rather, these studies show that the expression of anger is learned behavior and that more appropriate ways of expressing anger can also be learned. A second myth is that anger automatically leads to aggression. A related myth involves misconception that the only effective way to express anger is through aggression. There are other more constructive and assertive ways, however, to express anger. Effective anger management involves controlling the escalation of anger by learning assertiveness skills, changing negative and hostile self-talk, challenging irrational beliefs, and employing a variety of behavioral strategies. The third myth is that you must be aggressive to get what you want. Well, many people confuse assertiveness with aggression. The goal of aggression is to dominate, intimidate, harm, or injure another person, to win at any cost. Conversely, the goal of assertiveness is to express feelings of anger in a way that is respectful of other people. Expressing yourself in an assertive manner does not blame or threaten other people and minimizes the chance of emotional harm. The final myth is that venting anger is always desirable. For many years, there was a popular belief that the aggressive expression of anger, such as screaming or beating on pillows, was therapeutic and healthy. Research studies have found, however, that people who vent their anger aggressively simply get better at being angry. In other words, venting anger in an aggressive manner reinforces aggressive behavior. That's this month's Medical Myths. If you want more information about help with anger management, you can contact the Frederick County Health Department. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. Welcome to this month's edition of Health Tips. As many of you know, the prevalence of chronic diseases and the exceedingly high health care costs associated with the management of these diseases have led to an increased focus at all levels of our society on how to make the healthy choice the easy choice. Strategies to achieve this include making neighborhoods more walker-friendly, increasing access to healthier foods at restaurants, incorporating more physical activity throughout the school day, or establishing policies that promote breastfeeding. Another approach, and the focus of today's health tip, involves encouraging work sites to adopt workplace wellness programs or to make policy and environmental changes that promote healthy choices. According to the Partnership for Prevention and the U.S. Chamber of Commerce, no matter how well decision makers attempt to manage the supply chain for medical services and/or shift a greater cost burden to their employees, their attempts will have a limited effect. There needs to be a concurrent reduction in the demand for health services through integrated prevention, risk reduction, and disease management practices. Today, a growing number of organizations understand that investing in a comprehensive health management strategy not only is the right thing to do for protecting and enhancing their human capital, but it also makes good business sense. A popular worksite wellness strategy for achieving this is to focus on primary prevention and to minimize risk for health problems, thus keeping the majority of the workforce and its dependents low risk and healthy. Why do this? As noted in Healthy Workforce 2010 and beyond, a significant percentage of deaths in the United States are associated primarily with modifiable lifestyle-related behaviors. Remarkably, more than 1/3 of all deaths are attributed to just 3 general factors: tobacco use, poor diet, low physical activity, and their influence on obesity, and excessive alcohol consumption. Maryland's Department of Health and Mental Hygiene offers Healthiest Maryland Businesses as a resource for organizations who are interested in taking steps towards creating an environment that supports healthy employees. This creates a win-win, whereby employees and their families are healthier and companies save on healthcare costs and absenteeism. Additionally, these efforts can improve morale and can help organizations attract and retain the best candidates. The truth is, the health of your workforce drives the health of your business. For every $1 you invest in your employees, you can save between 3 to more than 5 times that amount. These savings result from reduced healthcare costs, reduced employee absenteeism, and increased employee productivity. Working Marylanders spend an average of 9 hours per day at work, leading to a decrease in the amount of time available for exercise and healthy eating. So what can work sites do? Actions can range from small to comprehensive, but taking a 3-pronged approach that combines individual strategies with environmental and policy changes can increase impact. A few examples include: establish a smoke-free work site and campus policy, make smoking cessation classes available in the workplace, offer work site-based incentives and competitions, establish a wellness committee made up of employees that steer the direction of a worksite wellness program, establish a healthy meeting policy to promote the serving of healthy foods and physical activity breaks, implement healthy food and beverage standards in on-site vending machines. Worksite wellness is most effective when one uses a planned approach that involves getting buy-in from upper management, assessing employees and the environment, and then choosing strategies based on these findings. If you are an employer or perhaps an employee interested in starting a wellness committee where you work, there are a number of resources available to assist you. Consider starting by visiting Maryland's Healthiest Maryland Businesses website or the CDC's Healthier Worksite Initiative. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.